Welcome to Community Forum. I'm Dr. Phyllis Schiffer-Simon, the Director of Beacon, and your host for this program. Today we are going to talk about a completely curable yet extremely serious health issue, amblyopia. Amblyopia, or lazy eye, is an eye condition that if diagnosed before the age of 5 and treated prior to the age of 8 can be cured. Joining me on our first segment are Dr. Bruce Miller, pediatric ophthalmologist, Jennifer Beer, mother of a child recently diagnosed with amblyopia, and Marie Oakes, an adult with amblyopia. Welcome to Community Forum. My first guest is Dr. Bruce Miller, who is the managing partner of the Pediatric Ophthalmology Consultants of South Florida, as well as the medical director for the pediatric at Chris Everett Children's Hospital. He is also the founder of the I See Kids Vision Screening Program that aims to eliminate amblyopia or lazy eye. Thank you for joining us today, Dr. Miller.
Thank you so much for having us.
Let's start first with a definition. What exactly is amblyopia?
Amblyopia, otherwise known as lazy eye, is when one eye does not develop good vision compared to the other eye. And there's several different reasons. Sometimes it's just that the power of the eyes are different. Sometimes there's something in the way of the vision, something in the lens of the eye. There's a lot of different reasons, but it doesn't really matter why the child develops it. The important thing is to screen children early, make sure that you find out if they have good vision in both eyes early, so that if they do have amblyopia, you can reverse the process and get them excellent vision.
So are infants born with this condition, or it's something you see develop as they're young children?
It can happen both ways. More often than not, the child is born with a condition where one eye doesn't see as well as the other. It's very hard to pick up at a very, very young age. And about 3, 4, 5 years of age is the best time to start looking for amblyopia.
How common would you say amblyopia is?
It's actually quite common. 2 to 3 children out of every 100 children have amblyopia of some sort. So that's a lot of kids.
So in essence, the eyes are not developing at the same
rate
or pace. One is stronger?
Exactly. One eye is the stronger eye, the other eye is the weaker eye. And what happens is if you don't step in and treat it medically somehow, and there's lots of different treatments, it really depends on the underlying problem. But if you do not step in and treat it, then the good eye gets better, compensates, and the bad eye just keeps getting worse, and gets lazier, and that's why it's called lazy eye. I just want to point out that a lot of people, there's a misconception out there that lazy eye is when one eye drifts out, or when one eye crosses in, or when the lid droops down. That's not really lazy eye. Lazy eye is when one eye doesn't see well. All those other things can happen later if you don't treat the amblyopia or lazy eye.
Very interesting. And so if you were to just look at a child visually that has lazy eye or amblyopia, would you see manifestation of it? Well, you would, because you're a medical expert.
Actually not. That's a great question, and that's exactly why we're here today. Right there. That's the point. To tell parents that your child, to you and to the rest of the world, and even to a trained eye, and even to a pediatric ophthalmologist, will look perfectly normal. The kids who don't look perfectly normal, the kids who already have a drifting eye or a crossed eye, those kids are the parents are gonna seek medical attention anyway. But it's to the masses out there who are walking around with one maybe legally blind eye, and the parents are saying, there's no way my kid doesn't see well. They can see the little plane up in the sky, or they can see the ant all the way on the floor over there. That's the family that we want to reach out to. Those are the moms and dads that we want to reach out to and say, make sure that your normal looking child has a vision screening by somebody, either a pediatrician, a trained volunteer like a Lions Club or a Prevent Blindness volunteer, an ophthalmologist, or an optometrist. It doesn't matter to us who you get that screening done by, but get it done early before you start kindergarten, around, like I said, 3, 4, or 5. 4 or 5 is probably the most common age to have the screening done. And then, if we do find the problem, there's plenty of time to treat it and reverse it.
Okay, so early detection, child is 3, 4, 5 years old,
Hmm.
having a screening by a qualified professional, and hopefully then you can detect what you can't see just looking at the child. Later on, that condition can manifest itself where you'll see more of the eye drifting or more indication. Accurate?
That's exactly right. And once a child, let's say they pass the screening, that's great. They probably have great vision. But the child who fails the screening, then you have to take it to the next step and have that child seen by an eye care professional. And they can make the diagnosis of exactly what's causing the amblyopia and set out a custom plan to reverse the process.
Okay, let's talk a little bit about the screening.
Okay.
And then we're going to speak with Jennifer, who is the mom of Sarah, who has actually been treated for amblyopia. But tell us, if you would, Dr. Miller, what takes place during a screening. So if a parent were to bring a child for a screening, what could they expect?
Okay. A vision screening, which completely differs from a vision exam, and that's something you just have to learn about early so that you know the difference, because an exam is really more of an undertaking. A good eye exam, you're going to get dilating drops in the eyes, make sure that an eye care professional is really looking behind the eye and finding out a lot of the details of the issue. But a vision screening is incredibly simple, and it's not time consuming. In our hands, we've trained a team of vision screeners. These are pediatric ophthalmology technicians who, depending on the child's age and their cooperation, probably takes anywhere between 2 minutes and 5 minutes. The younger the child, if they can't do some of the screening tests, then it's a very, very quick exam. And in the older children, it takes a little bit longer, but we get more information. A typical exam would be to simply test the vision by putting an eye chart 20 feet away. If the child knows their letters, their alphabet, then we use the regular, it's called Snellen chart, so they can test one eye compared to the other eye as far as what they're actually seeing. If the child does not know their letters, then we go to a picture chart. So the pictures are simple household things and telephones and cars and trees, and the kids love the picture chart, and even a 2-year-old or 3-year-old we can usually get a pretty accurate assessment of their actual vision.
And so the child comes in for a screening, and what you're looking for are some big discrepancies between how the two eyes see, because I would think that you could normally have a little bit of a discrepancy.
Mm-hmm.
I guess we all do. Unless you have perfect vision in both eyes. But you're looking for something more marked in the child that would indicate that one of the eyes is being lazy and the other eye is compensating.
That's right. As a matter of fact, you don't have to have perfect 20/20 vision to pass a vision screening at that age. If you have more than 2 lines difference between the eyes, or if your vision is worse than 20/30 in either eye, then you've failed the screening, and you should go on to have an eye exam, is the current recommendation.
Okay. All right, well, we're going to come back and talk a little bit more with Dr. Miller, but now we're